For our treatment room preparation for a radiology patient, we need to make sure that we do have a few barriers in place prior to bringing your patient back. First is making sure that our exposure button has a piece of tape over that. Our chair and headrest cover are covered. We have a piece of tape on the exposure panel. And then last is a barrier over the tube head. Supplies to have out prior to bringing your patient back so that you are set up and ready to go would be a film mount, your tray with your XCP supplies. You would have your film as well, and then a pen to make any notes in the chart or to document the blood pressure, which is with that automated wrist cuff there. Okay, we are going to walk through the steps to seat a patient to take our radiographs. So I'm going to go ahead and have my patient come on in. She's going to have a seat here. You want to make sure that the armrests are out of the way as they sit down, but then go ahead and slide those and lock them into place. After they're seated, typically you would go over their health history here, go over any questions they may have, take their blood pressure with the wrist cuff and note that on their health history. And then we want to go ahead and obtain consent, meaning we need to make sure the patient knows why we're taking x-rays and what we're going to be doing. The doctor wants us to go ahead and take some x-rays today. Is that okay with you?
Yes.
Okay, so we obtain consent. If your patient was wearing eyeglasses, you want to remove those. If you want to ask if they have any removable retainers, appliances, anything like that as well prior to taking your x-rays. All right, so now we need to get her positioned. So her head is much taller than where my headrest is. So I'm going to go ahead and bring my headrest up. Okay, go ahead and rest your head against the headrest there. Perfect. And then we want to just make sure the occipital protuberance, which is the back of the head, is nice and flush with the headrest. And then our mid-sagittal plane is the tilting position of our patient. So we need to make sure that their head is nice and perpendicular. She's not tilted one way or the other, or chin too high, chin too low, just nice and flat here. So once you have that, we can go ahead and put our lead apron over hers, and we're going to go ahead and secure the thyroid collar behind the neck right there, and then we will put our patient napkin, the plastic side, against the lead apron and get that secured over our patient here as well. Okay, and then now we would be ready to go expose our radiographs.